morning, everyone. Super excited that you're all here today. Welcome to Stanford Healthcare's Nurse Residency Program application webinar. I am going to get us started here by you've probably figured out we're going to record this today. The recording should be available by the beginning of next week at the very latest.
Uh-huh.
My name is
Yeah.
Christine Norris. I'm a nursing professional development specialist here with Stanford Healthcare, and I directly support the nurse residency program. So we will have a Q&A, question and answer session on our
Uh-huh.
site, or rather later on after this webinar is done, with nurse residents that are actually here and part of our program. So we're really excited. I'm going to introduce them to you in a few moments. What I'm going to do, just some housekeeping here in addition to the recording, is ask you to hold all the questions you might be having. I'm going to ask you to hold all the chat as well. Right now, what I want you to do is kind of sit back, relax, enjoy the webinar, take some notes, and be thinking about what questions you might want to have so that later on in the question and answer session, you'll have an opportunity to ask those. Okay? So let's get started here. And the first thing I'll say here before I introduce the team is that the information that we're sharing today is regarding our webinar and specifically around the application and our cohort that is starting in August of 2025, so August of this year. So if you are watching this at another time and you're getting confused, that is the information that you're getting today. So let's introduce the team. So first things first, I'd like to introduce our program director, Carrie Zoss. She is our Transition to Practice program director for the Nurse Residency Program. In addition to the Nurse Residency Program, Carrie oversees the Critical Care Training Program, our Acute Care Transition to Practice program, and our Oncology Training Program. Leticia Cortez is a nursing professional development specialist and program coordinator for the Nurse Residency Program, along with myself. And last but not least, Carly Dye. She is our HR partner and senior talent strategist supporting the Nurse Residency Program. And now I'd like to introduce the three current nurse residents that I have here today joining us. They will get an opportunity to introduce themselves later on, but we're very excited to have them here and excited for a very robust question and answer session that we have planned for later. So before we jump into the nurse residency program, I'd like to take a moment to really highlight who Stanford is for those who may not be familiar with our organization. Stanford Healthcare is a large academic medical center with more than 300 facilities throughout the Bay Area. Stanford has the unique ability to adapt to the patient's needs. So when outside of the critical care units, our acuity adaptable units, or AAUs as we call them, in the surgical, medical, and oncology areas, can care for patients in either an acute care or med-surg area, which is a 5-to-1 ratio, to intermediate care or IIC, which is a 3-to-1 ratio. So, for example, in our acute care areas, if a patient requires more frequent intervention or monitoring and becomes an intermediate care patient or IIC, our AAUs are equipped to manage their care. Whereas in other models and other institutions, a patient with increasing needs may need to be transferred to an intermediate care floor or unit. We are a magnet institution, and that means our organization is really committed to the highest quality professional nursing practice and healthcare outcomes. And we're excited to also share that we are on our 5th magnet destination journey. We are the only level 1 trauma center between San Francisco and San Jose. In total, Stanford Healthcare employs over 15,000 individuals, and of that, 3,500 are clinical nurses. Our Palo Alto campus has over 605 licensed beds, 105 licensed ICU beds, and there are more than 450 life flight transports annually. The Palo Alto campus alone is more than 800,000 square feet, just to give you kind of a sense of the footprint here. We see approximately 100,000 emergency room visits per year and over 2 million outpatient visits per year. We are a large, high acuity academic medical center. So now on to who the residency program is. Who are we? So our program is a recognized Vizient nurse residency program since 2006. Our residency program is nationally accredited through the American Nurses Credentialing Center, that's the ANCC. The ANCC really sets the standard for nurse residency programs that transition registered nurses into practice settings. So we are currently getting prepared for our reaccreditation and our virtual visit in just a few weeks. So wish us luck. The residency program successfully helps to transition newly graduated registered nurses into multiple different clinical settings. And really, our overarching goal is that our comprehensive one-year program is really to develop compassionate, dedicated, and smart individuals who make a positive impact in the lives of our patients that we serve. So, I want to spend a few minutes talking about what it would look like to be a resident in our residency program. We get a lot of questions about the first few months and what that might look like. So, our residency program is 12 months in length. Your orientation will be with a trained preceptor, and that will be a minimum of 12 weeks. Depending on the specialty area that you're hired into, it could be a little bit longer. In addition to your precepted shifts on the floor, you will also complete online education and attend the nurse residency program seminars. The first couple months, seminar will be twice a month. And then after that, around month 3 will be once a month, and the remainder of the program will be once a month. During these first few months of the residency program, you're going to participate in 3 unit-based education sessions. On top of that, in certain specialties, you will have additional in-person or virtual education sessions or workshops. And I want to emphasize this is all paid time and all part of your schedule. And I share this with you so that you have a sense of how busy this time's going to be. It's going to be really full. And so if you're working night shift, you're going to want to keep in mind that you are going to be attending most, if not all, of these sessions during the day. So you're going to have a lot of discipline, whether it's days or nights, with life in general. So making sure that you are prioritizing yourself, make sure you're prioritizing your sleep, your eating, your schedule, and incorporating things that bring happiness into your life. Those are going to be really important. Depending on the specialty area you're hired into, there may be some additional workshops, lectures, education that could be required and that you would continue to participate throughout the 12-month program. There's also programs that you will extend beyond that. So, for example, the oncology training program at 6 months, all oncology prepared nurses are going to be automatically participating in the oncology training program. For the next 9 months, you will be attending specialty training related to chemotherapy certification. And I really want to emphasize that we are a highly specialized academic medical center. So the patients we care for have increased needs, which means the nurses that are caring for them are going to require some increased training and education. So part of how we meet our goal and developed compassionate and dedicated smart individuals is with our curriculum. So the nurse residency program is a partnership between Vizient and the American Association of Colleges of Nursing. This curriculum was designed with the new graduate nurse in mind to really support them during their first year of their professional career. The intention of this curriculum is to decrease nurse rate turnover. And so we also want to improve our decision-making skills, enhance clinical nursing leadership practices, and really promote the incorporation of research-based, evidence-based practice. So with our program, it really takes everything, all of your background, all of your experiences, all of your skills, and then we build upon those. So we connect it all and how it would be applied in the clinical setting as a nurse transitioning towards competency during their first year of practice. So the key domains that we focus on are leadership, professional development, and quality outcomes. And specifically how we integrate this will be discussed in a moment. So let's talk a little bit about our project structure and really what that consists of clinical orientation, collaborative check-ins, program seminars, and then an evidence-based practice project. So let's look at those just a little bit closer. So the first layer is orientation. Nurse residents receive over 350 hours of clinical orientation with a trained preceptor. We use a tiered skills acquisition model. We call it TSAM. So each tier builds on the previous. Essentially, it's a progressive, incremental skills acquisition model. The resident will move through simple to complex care concepts. So the nurse resident will start caring for all the patients in a given assignment, but their focus will only be on certain aspects of that. For example, maybe just vital signs and assessments. Once the resident is competent in that tier, they advance and assume more responsibility, building on the previous tiers. The specialty area the resident is hired into will determine the length of their orientation. And again, our goal is to safely transition the resident to independent practice. The second layer is collaborative check-ins. So we follow the nurse resident with supportive and collaborative check-in meetings over the course of our 12-month residency program. So a member of the nurse residency program team will collaborate with the unit leadership and follow the nurse resident as they progress through the program to offer support where and when needed. We celebrate successes and really help to identify opportunities where there could be some refinement. And then again, we want to support that resident to be successful and safe. Check-ins are around 20 minutes in length and they occur every few weeks throughout the orientation period. The third layer includes our program seminars. So seminar is in person at one of our education and training sites and facilitated by the nurse residency program faculty. We do not reteach nursing school. Instead, we integrate concepts to really support and help you to apply your knowledge and your skills at the bedside. So topics are aligned with Vizient domains of leadership, professional development, and quality outcomes. Those include clinical reasoning series, a prioritization lecture, communication, resource management, escalation, managing error, and then a wellness series. In addition to that, we also integrate teamwork and team building activities. And then the fourth layer to our program is our evidence-based practice project. So all residents are required to complete a group evidence-based practice project, and the EBP sessions really support the development of critical thinking and clinical reasoning skills. Project topics are aligned with the priorities of the organization and the specialty areas. Residents are supported through that process by the nurse residency program faculty, as well as clinical nurse specialist coaches throughout the project. And again, this is all during work hours. The projects are presented at the end of the residency program as well as at the unit level. And then depending on the type of project completed, it may be featured or presented in additional meetings within the organization. So as a magnet institution, structural empowerment is really a critical component to grow the workforce in our organization. And we understand that individuals want to invest in themselves, and they want to do that through different professional development opportunities. Stanford is uniquely able to provide those many opportunities for professional development. We are committed to grow and develop our clinical nurses from the moment they enter the nurse residency program and throughout their career. Once their resident reaches 6 months of employment, they promote to a clinical nurse 2. And so at that time, nurses have access to tuition funds that can be used towards formal education opportunities. Some of those opportunities nurses will have available to them are being unit champions, participating in organization-wide committees, participating in mentorship as maybe a mentee or a mentor, and then working on clinical ladder promotion. So, a question we often receive is how many individuals will be hired for the fall 2025 cohort? And my answer to that is it always depends. The area and number of residents hired really fluctuates based on the available positions in the organization. Currently, we don't have a set number, but we have the regions that will be participating in the fall 2025 cohort that starts in August. So I want to emphasize that all of this is subject to change based on the needs of the organization. So Stanford is a specialty hospital, so the specialty regions for the cohort include oncology, surgical, and medical AAUs, in addition to the float pool. The interventional platform with the main OR will also be hiring, and then both the pediatric and adult emergency departments will also be hiring. One note about the float pool is that the float pool serves the surgical, medical, and oncology AAUs, and this is also where the training takes place. So depending on the needs of the organization on any given day, that nurse would be floating to the area in need. So we'll talk about specialty preference in a little bit, but I want to point out that there are regions that have more of an abundance of opportunity, such as the medical, surgical, and oncology regions, rather than, say, the float pool. Float pool is, while a large department, is only potentially hiring 1 to 2 residents. So the opportunity to interview is going to be a little bit more competitive, whereas in the medical, surgical, and oncology regions, you would be interviewing in front of multiple managers for those areas. So hopefully that makes sense. The emergency department is very specifically looking for individuals who have experience in the emergency department. So while that might sound interesting and intriguing to you, you'll want to be thinking about, did I have a clinical rotation in that emergency department? Was my capstone there? Have I been working as a tech? Do I have EMT experience? That's kind of what they're looking for. So keep that in mind when you're thinking about those preferences. And I'm sharing this with you so that you can make an informed decision as to your preferences on the application. All of this is completely up to you, but it does warrant some thought. So let's take a look at the timeline for our next cohort that starts in August of this year. So that's cohort 43. Go ahead and take a picture if you'd like. This is the time. These are some important dates that you are going to want to remember. So the application webinar is taking place today. Application posting is in just a couple of weeks. So that starts March the 24th through April the 6th. We'll then spend about 5 or 6 weeks screening the application. And then from there, we will be conducting the unit and panel-based interviews. Those start on June the 16th through June the 27th. And then the cohort starts August the 18th. One really important date I want to call out right now is that you must have your California license by July 11th. And that date is very purposeful. We need you to have that in hand by that time so that you can clear all of the pre-employment process should you go through the interview process and be offered a opportunity here at Stanford. So remember, July 11th, you got to have your license by that date, okay? So let's talk a little bit now about the application. And the first part I'll talk about is the application requirements. So you must be a graduate of an accredited nursing program with either your associate, bachelor, or master's degree in nursing. And we often get asked, can I apply before I graduate? Can I apply before I have my RN license? Absolutely. We understand that some of you are finishing school right now and that your date, you might not have that at this time. You absolutely can apply as long as you're anticipating that you will graduate and have your license by that date, July the 11th. So you cannot have more than 6 months full-time experience as a registered nurse. And so when you break that down into hours, that is 1,040 hours, and that's by the start of the cohort. If you do, you are welcome to apply to our clinical nurse 2 positions. Sorry, jump forward there. So, in terms of the transcripts, your official graduation transcript cannot exceed 18 months prior to the cohort start date. So that's between February 2024 and August 2025. That's your window. We're also going to ask that you use one name that remains consistent on all your documentation. So your resume, your transcript, and your application information. So for example, let's say your given name is Christine, but you go by Christy. If your transcripts say Christine, then you'll want to use Christine on your resume and your cover letter too, as well as the application. We want to see that consistency, so we're making sure that there's no confusion about who is who and that things aren't getting confused or mixed up. And then lastly, I also want to share that we no longer require clinical faculty references. So if you were doing your homework on the program previously, that was something we asked for, but we no longer ask for clinical faculty references. A question that we sometimes get asked is, if I've applied before, can I apply again? You absolutely can. You just need to keep in mind the dates and information that I have shared. And so now you might be thinking, okay, so what do I need to submit? What do you guys want to see? So let's break that down in the next slide. So this is a list of the required documentation that you'll need to submit for your application. So again, we're going to need your transcripts, official or unofficial. Be sure that that graduation date is not greater than 18 months prior to the cohort starting. Again, the cohort starts in August, so 18 months, and that is your February to August window that we were just discussing. You're also going to want to make sure that you upload a cover letter and a resume. In the resume, be sure to include all of your work experience, not just nursing related. If you participated in a nursing internship or externship, include if you served in the military, if you have any volunteer experiences, and then we've listed all of these in red. So that's what we're really looking at and what we're scoring. So We'll get to the application questions in a few slides, but I wanted to share this. And then in terms of submitting all this information, you can submit it one of two ways. You can either submit each of those documents individually, okay, or you can combine them all into one PDF and upload all of it at one time. We recognize that sometimes those files can get a little bit large, and due to the system, it won't allow you to upload it. So it's your preference. You can upload it at one time or three individual documents. That is up to you. So this is simply a suggestion. So let's talk a minute about your cover letter. So a cover letter is really a personalized introduction to who you are. It really allows you, the applicant, to share with us, a potential employer, your qualifications, your interest in the position that we're offering. So we use the cover letter to really get a sense of who you are and how your experiences have and the requirements of the position align. So you may choose to share why you're pursuing a career in nursing and what's motivated you. What have you done to get to this point? You might share what makes you uniquely qualified for this role. And these are really just like a culmination of all your experiences thus far. Those can be personal experiences, clinical rotations, education, work experience, volunteering, military, any of them. There's a number of them. You might want to share why you're choosing Stanford and why it's important to you, and then what you're looking for in an organization, and then what you have to offer an organization. Again, how are your values aligned with ours? And then lastly, what do you hope to accomplish in the future? And again, these are just suggestions. This is your document, your letter. So just keeping in mind that this is about you. The main purpose of this cover letter is really to support the content within your resume. And your resume is going to focus on your qualifications, your achievements, your past experience. The cover letter really just expands on those and showcases your personality and explains why you'd be a good fit for our organization. Gives us some insight into your soft skills, your attitudes, and what motivates you. So we get a lot of questions about formatting and what we want to see on a resume. So let's look rather at an example. And so this is a great one. It's very generic, and we did that for a reason. But a resume really provides kind of a summary of your experiences, your abilities, your skills, your strengths, and your accomplishments. And it really provides that relevant information regarding your education and job-related experiences and interests. It demonstrates what you've done in the past, which should align with the qualifications of the job that you are seeking. So think of your resume as a personal marketing tool. It really allows you to really effectively and communicate your assets to a potential employer. So listed on the slide is again a sample. How you wish to display and format is really up to you, but everything listed here on this resume sample needs to be there for us to review and score. So areas that we score on the application around work experience, whether you've had an internship or an externship, if you've served in the military, if you've had any volunteer experiences, and then if you have had volunteer experiences, please make sure you include the number of hours that you volunteered for. That's very important. We get a lot of questions around resumes and cover letters and around the format and the length and what should and shouldn't be put on. And so if you think of a resume as that advertisement, it advertises you, your unique skills, your qualifications. So be concise and be sure to include the areas that we've outlined above. So some other questions we get are, what do I do? Or what do I put if I'm still completing my clinical hours? You can put in progress. And do we give extra points for certain nursing schools or GPAs or degrees? We do not. Do you give extra points if you've had a clinical rotation at Stanford? We absolutely do not. However, we want to know if you had. So if you've had a clinical rotation at Stanford, make sure you put that on there and then let us know which unit and department. That will help us because should you get through the screening process and score high enough to receive a panel level interview, that would help us maybe align where to place you. Should I list non-healthcare related work experience? Yes, please do. We more often than not see that people only put nursing related. We want to know about all of your experiences because they all translate to nursing in one way or another. And then is all volunteer work acceptable? Yes, it is. So again, put it all on there. You might be confused about what an internship or an externship is. And it's so a nursing, an externship or internship is going to be nursing related first and foremost. So if this is in externship in research or following a provider, that's not necessarily what we're looking for. We're looking for those nursing internships or externships. They're going to be outside of your clinicals, outside of your capstone. It can be paid or unpaid, and you would really have to probably apply for it. And there's usually like an end date. So you're there for a certain amount of time. We get asked if you should include your RN license if you have it. Absolutely. Share that with us. Sometimes we're asked about providing ACLS or BLS. That's not necessary at this time. Should you move through the panel or unit level interviews, then and be offered a position here at Stanford, we will ask you for that information. So you don't have to share that at this time. And then lastly, we often get asked, can you share other things on your resume, such as skills and certifications and accomplishments? You absolutely can. That is a personal decision that you can decide on. But you don't need to upload any of that with your application. We're looking for very specific things in terms of the required documentation, which I've gone over and I will go over again, but those are not it. So we're not going to look at them. We're more interested in those priority documents that I've already shared, and that's your transcripts, your resume, and your cover letter. So let's talk a little bit about the electronic application, and you might have some questions about that. So in the application, you're going to start off with some demographic information. So it's mostly yes and no's. Where did you hear about this position? Will you be willing to commit to a one-year residency program? And that you understand that you will need to have your California RN license by July the 11th. So those are going to be all important, mostly all yes and no's. Um, we're also going to be asking you about your preferences, and this is where you can share that you'd like to work in these specific areas. And so I shared those earlier. We try to place people in their top choice. And so depending on how quickly a specialty interview panel fills up, we may look at your second or third preferences. And so if you have a particular passion for a certain area, I would say select that as your first choice. Okay, if you're unsure and you're open to different experiences, then I would keep that in mind. And maybe there are more departments, or if you think about it, there are more departments interviewing with medical, surgical, or oncology areas. And so perhaps maybe you start there in terms of your preferences. And so the opportunity to interview is really competitive, meaning there will be less departments if you were to choose like float pool, for example, and then keeping in those requirements that I had mentioned regarding the emergency departments. So let's look at the recommendations around the electronic application recommendations. And so, as a reminder, there's only about 2.5 weeks or so right now until that application opens. And so, with that, you want to ensure that all the areas of the application have been thoughtfully and thoroughly completed. And really, to do that, I think it's important that you provide yourself time to do that. So, I would recommend that you not wait until almost the end of the application closing. Application opens, be ready to go. You know that it's going to be coming in the next couple weeks. So ensure that you have all the required documentation. Again, we recommend either one PDF, but also realize that that file size might be too big. And so you'll want to ensure that all three of those important documents are uploaded. Again, that's your resume, your cover letter, and your transcripts. So applicants who do not submit the required documentation will not be considered and their applications will not be processed. So very important. One way to ensure that you have uploaded all that information is to create an account. And that enables you to go back and really look at your application and ensure all the documents are there and everything is uploaded. And so it's also going to allow you to really follow your application status. So the thing to keep in mind is you'll create this account. It might take up to 24 hours in order for you to view all of that. So don't panic if you create your account and you go back and you still don't see anything. Give it about 24 hours or so, and then you should be able to see everything you need to see. If after 24 hours you don't see all your documents, then you may email newgradrn@stanfordhealthcare.org with your documents, but we're only going to give you until April the 8th at 5 p.m. Pacific Standard Time. Okay? We're also asking you not to submit multiple applications. So again, don't submit and don't start it until you're ready to, okay? And knowing that you have a couple weeks, you should all be ready to go when it opens. And then lastly, as I already mentioned, don't wait till the last minute. It's very stressful. It's like Murphy's Law, right? That something could go wrong. And so you don't want to wait and your computer all of a sudden doesn't want to work for you, or your internet goes out, you don't have power, or you can't find your documents that you need to upload, or something is happening and you're rushing, and then you upload 2 resumes instead of a cover letter and you don't have all your documents. So don't wait till the last minute. So let's talk about the application questions now. So these are super important. As you begin preparing your application, you're going to want to start to draft some responses to these questions. And these are the questions, guys. So take a picture if you need to. All right. So a good place to really start is kind of doing a brainstorming activity with yourself. Start writing down some of your experiences and your scenarios that you could use as it relates to these questions that we're asking. And as we look at these questions, you'll see that each question has multiple components or parts to the question. You're going to want to ensure that you are answering each and every one. So the last portion of the question is really what we're looking at, and we have bolded those in each of the questions, okay? So when you're thinking about this bolded part, okay, to help you answer that, think to yourself or ask yourself, what makes this experience memorable? How much reflection and learning occurred as a result of this experience? What am I doing differently now as a result of having this experience? How can I share or emphasize how this experience is taking me beyond nursing? How has this journey to this point shaped the way I think, act, or perform? And then lastly, do I demonstrate a growth mindset? And is that evident in my response? So, looking at the first question, as you prepare your response to it, again, multiple prompts within it. So, you might begin with something like, a time in my clinical practice I experienced a caring moment was, and then this moment affected the patient outcome by. As a result of this experience, my clinical practice has changed in the following ways. And it's that last portion of the question that we're really looking at. What we really want to know is, how has this impacted your practice? What has changed in your clinical practice as a result of having this experience? So there's really a difference between acknowledging that this moment occurred and it happened versus being consistent and committed to specific caring practices. So really take time to answer these. It really could be the difference between an average answer and an excellent one. So let's look at question 1 again and look at it a little bit closer. So tell us about a time during your clinical rotation when you experienced a caring moment with your patient. How did this moment affect the patient's outcome, and how has it changed your clinical practice? So think about the clinical rotations that you had. Maybe even pick a couple different moments and kind of you can work through them both at the same time to see which one lines out better for you. And then tell us what happened, okay? And then tell us about the patient's outcome. What happened? Did they express feeling really calm after it, that they were relieved? Maybe they were refreshed. Maybe you made them laugh for the first time in days. What was it? And then lastly, how has this moment changed your clinical practice? So how do you enter a patient interaction or room differently as a result of this experience? What did you learn? Did your viewpoint change? Are you thinking about this from a different perspective now when you approach a patient or this type of situation? And as you think about it, imagine that you're telling this to someone who's never heard the story before. That's someone who it's not to someone who wasn't in the room. Okay. Don't let us assume that we're going to understand what you're talking about. Tell us all the things. So, whether it's being present in the room or taking time to sit with your patient and prioritizing them to get out of bed and going for a walk in the hallway, statements such as, I now prioritize compassionate care and advocacy when providing patient care is good. But what's going to make it great is how you actually do that. So take some time to be specific and tell us what you're doing differently. So if we look at question 2, tell us about a time when you had an error in judgment. It could be personal, professional, or academic. What happened? What did you learn from this experience? And how has this experience shaped you into the nursing professional that you are today? So tell us about your error. What happened? And most importantly, what did you learn? And how has it shaped your clinical practice? Sometimes with this question, we will get a candidate, and this actually happens more often than you would think, that will share maybe a difficult experience or share some difficult feedback they received. And while they meant to share it as an error in their judgment, they don't actually share what the error was. And so, again, think about your sentence structure. Okay, because this can help sometimes with that. An error in judgment I had was, and then share with it. Okay, and so when sharing, how did it shape your clinical practice? Think about how you demonstrate this. How do you ensure that it won't happen again? Maybe it was a medication error, or maybe how do you ensure that you're not demonstrating biased behavior? Then how has it shaped your professional into the professional you are today? So, think about how you show up differently. Um, it really, a good answer can be very general, but a great answer is going to be very specific. And so think about what you learned and then detail how that experience shaped you. How do you apply that lesson today in your practice? Think about how you do that. And that's again where you have to kind of slow down and start to write this out for yourself a little bit. In question 3, it asks, tell us about a time you provided service to a community. What type of service did you provide? So maybe you're assisting a neighbor in need. Maybe you're volunteering at a homeless shelter, coaching a sports youth league. It could be anything. And then how has serving a community prepared you for a profession that is committed to compassionate service? So again, you're going to slow down as you're answering these and share how serving a community prepared you for a profession committed to compassionate service. Again, how do you show up differently? How do you communicate differently? Do you approach the situations differently? Do you have examples of that? And then have you seen changes in your personal life or your interactions as a result of those? So you may have something around, having increased empathy. And so that's great, but elaborate on that. What does that mean? And how is it different now? And then the last question. So successful completion of a nursing program requires hard work, persistence, dedication, and resilience. So, share with us what initially motivated you to pursue a career in nursing. What goals did you set for yourself? What obstacles did you have to overcome to achieve those goals? This is a really tough question. And this question, um, the most important part of it is around the hard work, persistent dedication, and resilience. That's why we bolded those. Okay. So that's what we're looking for you to really demonstrate on how did you overcome those obstacles to achieve those goals. And we see similar themes with these questions having a lack of confidence, finances, sleep deprivation, missing family and friends, etc. So, what I want to do is really challenge you here to take it a step further. So, and it's okay to be vulnerable if it feels safe, but your story is unique to you. So tell us why. What did you have to do to overcome these obstacles? Don't minimize your journey. The question is asking about hard work, persistence, dedication, and resilience. This is what we're really trying to understand. So share those details with us. Using words such as this was challenging or this is hard is fine. But again, we don't know what was challenging and hard for you. We can assume it, but you don't want to let us assume it. You want to tell us. So, what did you do to work through it? Okay. It's hard and challenging for everyone, but why was it hard and challenging for you? So, break that down and be specific. The last thing I will share regarding the application questions is we know there's also a lot of technology out there that you may be wanting to use to assist you with answering your application questions. And so, what I want to encourage you to do is not use that. Okay. So, um, what we found is that sometimes we notice or we believe that some of this technology is being used. And then what we see is consistency between answers, whether it's sentence structure or wording. And so while we understand you'll want to use these platforms, we're going to recommend that you just spend some time drafting your responses to your questions. We're not scoring your sentence structure or your grammar. So we know that you might have some additional questions, things that we might not have gotten to today that or didn't answer specifically for you. And then depending on the question and answer session later, you might not have the opportunity to get that question answered, or you might not think of the question at the time. So this is our career site. I have the QR here. Go ahead and scan it. I'm going to ask Carrie or Leticia to put our link in the chat for you guys as well. That'll take you to our page. And so when you go to our careers page, if you scroll all the way to the bottom, there's going to be a section called frequently asked questions. If you click on that little red tab, it'll take you to a next section. It's going to ask, it has tons of questions that we get that you can review and look at. And if you still have a question that it doesn't answer or that you need some clarification on, then again, you can email newgradrn@stanfordhealthcare.org to answer it. All right. So some other important information that you're probably super curious about. Probably want to know how much you're going to get paid potentially. So the starting base rate for a clinical nurse one at Stanford Healthcare is $85.70 per hour plus differentials. So should you be working an evening shift, there is a 10% differential on top of your base rate. Night shift is 18%, and then weekend shifts are 5%. We also offer relocation assistance, and that's up to $5,000. That's for out of the area hires. So out of the area means more than 120 miles from Palo Alto. In addition to your base rate, you have a couple different banks of time that you start to accrue. So paid time off begins to accrue on the date of hire. A couple additional banks is ATO or absent time, and that's really used when there's excess staffing and then extended sick leave. This is some of our benefits and employment stuff. So we have 3 plans, medical dental, that you can choose from, one of which is employer paid. You will have access to FSA and HSA accounts that you can utilize, and then vision is included. There's tuition reimbursement up to $1,800 per year, and that can be applied to your pay back your student loans after the probationary period. And then some additional benefits too is we have short-term and long-term disability benefits, employer matching benefits, and then we have some great transportation benefits around carpool, commuter buses, and transport passes. So a few important reminders that I want to take a moment here. Okay, so let's go through this application checklist. So again, the 3 things you need. You need your transcripts, official or unofficial. You need your cover letter, and then you need your resume. On the resume, you're going to want to ensure that your education information is there, your clinical hours are there, and then your experience is there. So work experience, military experience, voluntary experience, internships or externships. Again, those need to be nursing related. Make sure they're all on there. And then you're going to want to make sure that you also complete the electronic application in its entirety, meaning answering all 4 of the questions. So as a reminder, you need to have your California RN license by July the 11th of 2025. You're going to only want to apply 1 time to the program, okay? If you're concerned that there was an error regarding your application, wait 24 hours, and then you can email newgradrn@stanfordhealthcare.org. Let them know what you think the error is, and then wait. Give them opportunity to look into it and get back to you with next steps. Please be mindful of the application window. Again, you don't want to wait till the last minute because things happen and we will not accept a late application. Please use one name, as I mentioned earlier, on all your documentation, resume, transcripts, and application information. Applications that do not have all the required documents, again, will not be considered, and so they will not be processed. And then, as I just said, answer all the application questions. Don't leave anything blank. Everyone's had a different experience, and depending on if you didn't have the opportunities to get an internship or externship, or you didn't have any chance to volunteer, it's those questions that are really going to help with your application, okay? So with that, we're going to go ahead and start to move on to the question and answer portion of our webinar. I want to thank you all for joining us up until this point today. I'm going to stop sharing in just a moment and ask our residents to introduce themselves. So I will have them come on. Let me stop sharing here. All right, there we are. Okay, guys. Hi, everyone. I can actually now all see your faces. So I'm going to go ahead and start with Nicole. Can you go ahead and introduce yourself to everyone?
Sure. Hello, everyone. My name's Nicole Kuriaku. I'm just about to finish up my nurse residency. I work on L7, which is an orthopedic unit. And that's it about me.
Thanks, Nicole. Dylan, could you introduce yourself?
Sure. My name is Dylan Tucker. I work on M5, a liver kidney transplant unit, and I just passed my probation period. Woo.
That's Dylan. Okay, and Alicia?
Hi everyone, my name is Alicia. I work on K6. Um, and yeah, that's me.
What kind of unit is K6?
K6 is urology and colorectal surgical.
Awesome. Okay. So I'm going to ask each of our panelists a question. And then what I'm going to go ahead and do here really quick is I see lots of stuff happening in the chat. So I'm going to ask that we keep the chat to questions regarding the program itself. And then if you have questions for the residents, I'm going to open it up to them in just a minute. So for Nicole, Dylan, and Alicia, could you share with us what made you successful with your application? How did you prepare? What do you think it was? And I'll just start at the top again. Nicole, do you have any suggestions? What do you think made you successful?
Yeah, so I definitely focus the majority of my time on the question section of the application. Um, And I hope some of you are keeping journals because that's definitely what I referred to when I was trying to think of all of these scenarios, and how they like affected me. Something I did use, I tend to think a little faster than I type. So when I was thinking about all of these questions, I did use like dictation on Google Docs just to kind of get my thoughts out there, as fast as I could, get that word vomit out, and then go back and start to taper things and, cut and copy kind of as needed. I sent my questions out to a lot of people for review. So a couple nurse friends, a couple non-nurse kind of corporate friends to take a look at. And I would say I probably revised them like a good three or four at least times before I kind of finalized everything. And I think also you're going to want to sit on them for a little bit. So write it out, think it's done, because in a couple days when you're hyperfixating on your application and looking things over, you're going to notice things that you're going to want to change. So definitely take your time on it, review, have people look it over.
Great advice, Nicole. Dylan, what about you?
Honestly, I just want to repeat the same points. I probably spent the most time on my essay answers. Reached out to friends, family, my nurses, my preceptor had my final semester. They all looked at it, and I worked on them. I was pretty on it. Like I worked on them for a couple weeks, and even just like the notes you take while you come up with, not come up, but you think back of your experiences in nursing school, and you come up with these scenarios you might want to use for your questions and answers. They might prove useful later on, at least for me, for when we got into the interview parts of the application process, when they might ask you for certain scenarios and how they made you feel, or um, yeah. So definitely spend a lot of time on your essays.
Good advice. Alicia, what about you? What do you think made you successful?
I think same, just to piggyback off of what Dylan and Nicole said. Definitely taking the time to really think about what you're saying and how it made you feel, and kind of going back to that moment, to really be able to put your ideas down on paper, and reviewing them several times, and having people look at your application, having people look at your resume. Sometimes we're just typing away and you can have words misspelled that you overlook, formatting stuff that you overlook. Definitely make sure you're taking the time to really make sure everything is detailed and almost to perfection if possible. But yeah, I think writing a journal was also helpful, and being able to go back to certain situations that you've encountered. And like Dylan said, that actually was also super helpful for the interview as well. So everything that you're doing now will eventually benefit you for the interview process as well. So yeah.
Yeah, that's great advice. And I was not, I didn't want to, add to anyone's nerves, but 100%, all the preparation you do with your application and those questions absolutely will lend to the interview phase as well as you're starting to tease out those examples and those stories that you have. So great advice. So I'd like to take this time now to open it up to everyone here on the call. So do we have any questions specifically for our residents? Go ahead, you can just put your virtual hand up and then I will call on you. Katiana, did I say it
Hi,
correctly?
yes. Yes, you did.
Okay.
Thank you so much, first of all, for having this little seminar and helping us out. And the panelists, thank you for your answers. They're very helpful. I just wanted to know what was your favorite thing about being a resident, and what's something that really helped you progress as a nurse?
Great question. Nicole, I'll keep the rotation going here. Start with you. Do you want to answer that?
Yeah, so I went back to nursing school as kind of a career change. And so I feel like I definitely had a lot of kind of nervousness about, am I doing this right? Am I good enough? Kind of all of those, kind of nagging questions. But there's so much support between the residency program, your preceptors, the check-ins. It's really hard to not feel supported, and as someone who needs a lot of reassurance, there it's constantly provided, along with constructive feedback. And so I feel like in the first few months I could tell I was growing, in my clinical practice and just my whole understanding of the nursing world and how Stanford works in general. And there were two parts to the question. Can you repeat
I guess it was just what was, and how did it make you like a better nurse? I think the first question was like your favorite resource that they offered, and the other one was how it made you a better nurse.
Yeah, so you're going to have your check-in. So the nurse residency program is going to have all of the seminars that are going to support your practice. And then with your preceptors, that's going to be focusing more on your kind of clinical practice. And so they both kind of work hand in hand. I wouldn't say there's something that benefited me more than the other. And I feel like as I have grown in my clinical knowledge, my professional kind of space has grown too, especially because of the NRP seminars. So,
Thanks, Nicole. Allie, did you have a question?
Yes, thank you so much. Also, thank you so much for giving us this opportunity. I wanted to know, I have like two questions, but my most important one is, what was your experience of the culture at Stanford working there? What does it feel like working and collaborating with your colleagues? That's my first question.
Okay. Dylan, I'm going to give that question. Did you hear her though? I was breaking up on my end. You're muted, Dylan.
I heard, what was your experience at Stanford, or how's your experience been? And I didn't get the second part.
Sorry, can you hear me a little better now?
Yeah.
My question was, how would you describe the culture and your experience at Stanford? What's the culture like working there?
I'm sure. Yeah. Overall, it's been very positive for me. I'm still 6, 7 months in, and I'm still asking questions to like anyone that's around me, and I've never gotten any pushback or any like, everyone's like, oh yeah, no, you got to do, like, they're super helpful. They're there to help you. Even with like some seasoned nurses, they'll still ask questions, and everyone's just super supportive of each other. I'm also a rotator, so that means I have done both the days and the night shift, and both have been positive experiences for me. Days a little bit busier. It's a little bit more hectic, so I feel like um, it's everyone's on a little bit of a time crunch to get what they need to do. But you do have more resources there. So overall, I've had a positive experience with both being on days and nights. Does that answer your question?
It does. I also wanted to know how you felt like, did you feel like emotionally or psychologically supported as well?
I would say both. I think at least for my unit, I could definitely vent if I needed to vent, or at least talk about my struggles. And then I also had my peers in the nursing seminar who, you go through the same things and you all have similar experiences, and we're all in a group chat and we all catch up after seminars, and we go out to eat and vent and have a good time. So, yes.
Thank you.
Thanks, Dylan. Thanks, Allie, for your question. Hi, George.
Hello, hi everybody. Thank you so much for the seminar. I just have a question regarding the screening process too. I was just curious on during the essays, what do you guys think made you guys stand out to make to get their interview process?
Alicia, do you want to take that one from your experience?
I think making it personal, like, you really want to show yourself on paper. And I know that's really hard to do, but kind of speak to your character and your personality and why a situation, particularly for you, impacted you and how it impacted you. I think it's a lot easier to give a generic answer versus making it personal. So talk about yourself, what what keeps you going, talk about your why. And I think those things really help to differentiate you from other folks. I don't know if that answers your question.
Yeah, it does. Thank you so much. I just have one more question too. So I was just curious. I know there's a lot of nursing residency out there, so I was just curious on like what makes Stanford like unique from the other nursing residencies.
In my personal experience, I think the amount of support that you get here at Stanford is incredible. From the beginning throughout your career here at Stanford, there's so many resources that Stanford offers to help you feel included, to help you feel supported. The residency program and the seminars combined are amazing because you have the opportunity to meet with other folks who are really going through the same things that you're going through, which makes you feel supported. It makes you feel like you're not alone. And then just the unit, I mean, just the culture that Stanford offers is amazing, even from, the nursing assistants to your nursing colleagues, even to the doctors, residents, interns. Everybody's there for the same goal, and that's to create a good experience for the patient. And you really sense that support from management as well. Like everybody that's there wants to see you succeed. So it's a really, really supportive environment, and I've loved it so far. So I think that really makes Stanford stand out from other residency programs, in my opinion.
Okay, thank you so much.
Thanks, Alicia. Thanks, George. Alana, did you have a question for the panelists?
Hi, yes, I did. Thank you guys so much for being here. Everything that's been said so far has been super insightful. But the question that I had, just because I know, just being human, I think there's always things we look back on and we're like, dang, I wish I would have done this. So I was wondering for our panelists if there was something that you guys wish you would have done differently, and any advice that you would give to an incoming new grad that's coming in to make the most of the opportunity.
Cole, do you want to try and take that one?
let's see, things I wish I would have done differently. So in my application specifically, I, you're applying to, however many places. I did go back and look at my application and I noticed like a typo, here, or there. I spelled orthopedic two different ways in my application. And so I think if there's anything, I wish I would have, I gave myself what I thought was a lot of time, but I think I wish I would have given myself more time. But also, remember, like I spelled orthopedic two different ways, but the sentiment of my essay still got through. So also give yourself a little grace too when thinking about your what I would have, what I wish I would have done and things like that if you're thinking about that later on down the road.
Definitely. Thank you so much, Nicole.
Can I
Thank
add to
you.
that too?
Yeah.
I would also just add, I wish if you do get to the interview phases, if you practice Zoom interviews with your friends or family, because unlike I think an in-person interview where you can really like feel out the room or the emotions and like convey that well, it's a little bit more difficult over a Zoom call. And I personally struggle with that. And I think at least for the start of it, some of my responses may have been a little robotic. So I wish I kind of spent more time actually practicing that like over Zoom with someone else. That's it.
Thank
Great
you.
advice. Corey, did you have a question for the panelists?
Yes, I do. Hi, everyone. Thank you again for all being here this morning. This has been super helpful. I have a question regarding the panel interviews. So sort of the second phase of the application process. What were those like, and what were some strategies you guys used to stand out?
Dylan, you were just kind of bringing that up. Do you want to take this one?
Sure. So for the panel interviews, you basically you'll get if you are fortunate enough to make it past this first phase of the process, you'll eventually sit down. At least for me, we sat down on a Zoom meeting with 5 or 6 other basically managers from different units who are basically interested, and you also sit down with 4 or 5 other potential applicants, and then each of you are asked a question, and it's the same question. So person 1 will ask a question, and then person 2 will answer the same question back. And basically they'll go to a next person. So whereas every person like doesn't get a heads up, at least for one question, like you got to be on the spot for at least one question. And then after that, you are super anxious and you wait a couple of days, and eventually like everyone's posting on the forums like, I got a call back. I got my call back on like day like 4 or 5. Like it was like the last people, and they're like, hey, we want to interview you for in person, can you be on this date? And then we did that, and then the in-person interview I think went along a lot better, and then usually like a day or 2 later you'll get an acceptance. As far as like things that have helped, I honestly like I had several peers in my nursing cohort that were all applying to Stanford together. So we were pretty supportive of each other, and we shared a Google Doc of like essay questions and responses, and we practiced with each other on what to say, and that worked for us. Yeah.
Thanks, Dylan.
Thank you.
You're welcome.
Israel, did you have a question?
Yeah. Wow, a lot of great questions already, but I'll tailor mine to a resume question. I've asked nursing hiring managers about what do they want to see in the clinical hours. And a lot of times they just say, look, we already know you did your rotation and how many hours. They want to see like what skills you have. And then, but yours is more tailored to just kind of clinical hours, location. And is that it? You don't need any kind of, do I just save that for the resume, for the cover letter then to talk about something like that?
Yeah, if you wanted to highlight anything in the cover letter regarding your clinical hours, you can. On the resume, it's just we want to know where, We want to know how long you spent there. So how many hours?
Okay. Thank
Yep. Julie, question for the residents?
Yeah, hi. Thanks all for hosting this webinar. It's been super helpful. I was just wondering if you guys could expand a little bit on your work or healthcare experience before getting to the program. I know that a lot of it's very helpful and can make you stand out. So I just wanted to see what could be beneficial.
Sure. Alicia, do you want to take that one?
Sure. So I was previously a PCA at a different hospital, but I actually worked with pediatrics, uh, and it was a very different transition. And I think what was super helpful was my clinical rotations. I feel like I didn't take enough advantage of my clinical rotations, to be honest. Like, I feel like when I was at clinicals, it was kind of scary, and I was more of a let me step back and not get in the nurse's way versus let me be more hands-on. But I think take advantage of your clinical rotations as much as you can. I don't know how far along you guys are in your nursing programs, but definitely take advantage of those. Start building connections with folks, ask a lot of questions because you're gonna ask a lot of questions, and now is the time to do it because you guys are students. Don't be afraid to ask questions. And I think if you can have any type of healthcare exposure prior to becoming a nurse, it's super helpful because sometimes things aren't as frightening and you're like, oh yeah, I know how to check a blood pressure. I know how to check a temperature. I know how to talk to folks, like that part can sometimes be a little intimidating too. You get so focused on completing your tasks and you forget that you're actually dealing with a person, like there's a person in front of you that you need to be able to relate to a certain degree so that they can trust you, and you need to be able to build those relationships. So, any type of work experience can give you that, potentially building connections. That's something that you can't teach. That's something that you have to inherently have. So yeah.
I
Cool.
was
Thank you
also
so much.
someone with no medical experience prior to nursing school. So to anyone out there that also has none, fear not. What did work for me though, little caveat though, I was in the military before. So one thing I highlighted was basically my leadership and teamwork skills, both in my cover letter and in my interview. And that definitely, I think, helped me stand out.
Thanks, Dylan.
Awesome. I just had one more question as well. What can you expand a little bit more on what measures success in this program? Like I know you talked about the TSAM precepting model, and how do you feel like that supported you through this process?
Anybody want to take that one? T-Sam, how was it?
I thought it was super helpful because it gives you the opportunity to care for all of your patients versus doing two at a time or one at a time. Caring for all of your patients and making sure you're mastering a task prior to moving forward with the next task is super helpful. And then because you're getting that real-time feedback, it's also super helpful, at least for me, it was. So it it allows you to really focus on one thing at a time, and it kind of makes you be able to time manage a little bit better, because when you're on your own, time management is something that I personally struggled with a lot. So I think being able to build up to that, being able to handle all of your tasks and make sure you're getting your assessments done. And I think the TSAM was, for me, very helpful along with the feedback that I would get.
Well, thank you all so much.
Thank you. Allison, did you have a question for the panelists?
Hi, yes, I do. I don't know if they're gonna answer it, but sorry, I'm a little sick. But how much of an impact do you think your grades in nursing school affected you getting chosen?
Nicole, what do you think?
Well, I would say I don't know if it's necessarily your grades per se, but um more so how much you were invested, in each class. I wasn't a straight A student. I definitely had, kind of fluctuating things, but I think I tried to make a lot of my classes, meaningful and intentional, and I think that is what helped me. Um, and I think having fluctuating grades is also showing progress too, So, um, I I don't know how much I would focus on that, but more so your experience. So one
Hmm.
of my favorite teachers who wrote my one of my recommendations letter, I think I got you know, like a B plus in her class or something like that. So um that's my experience with that.
Okay. Well, thank you.
Thanks, Nicole. Isabella, did you have a question?
Yes, hi. Thank you for being here. So I have two questions. My first one is, so I'm hearing a lot about how the residency program is providing a lot of support, which is great, but how has that support translated into the challenges that you face in your current nursing practice and patient care?
Dylan?
Well, I think when you find out when you talk to your peers, you're going through the same struggles, and just talking it out and venting, I think just really helps just get it all out there and know that like, hey, like I've made some mistakes and my peers have made the same mistakes. And just being able to talk it out and just understand like, hey, we're new in our nursing careers, we learn from them, and we can then, take those lessons and not be so hard on ourselves and just apply it to our own future nursing practice. So uh, I'm a huge fan.
Can I add to that?
Go for it.
So I would say like a specific example is that when I was with my preceptor, um, we a lot of it focused on communication between other team members, especially like providers, right? And you're going to run into situations where you might have to figure out how to communicate kind of like difficult things or maybe suggest alternatives. And I think if I was on my own, I would have had a very hard time figuring out like what was appropriate and how to say things and who to reach out to. And so I think that kind of support has set me up for success to be able to kind of have those conversations, you know, on my own now. So,
For sure, yeah. And then my second question is, can you give an idea of what the evidence-based project is like in terms of like the process as a nurse resident instead of being on the other end? You're muted, Christy.
It's hard for me to answer that question because we literally just started our evidence-based project last week. But at least for the start of it, you talk about it, they give you some slideshows and you do some prep. And then for the actual day, you sit down with an advisor and you brainstorm ideas and you come up with ideas for an evidence-based practice. And then you try to locate research articles for it to then basically research and apply to your practice. Like for example, the idea that we're thinking about is for central line dressings, especially IJs, the ones that go in the neck. I don't know if you've ever been during nursing school, those bandages always come off, and it can be a huge risk for like CLAPSs. So we're kind of going into the research of, are there other alternatives that Stanford could implement to keep those freaking dressings down?
Cool. Thank you so much.
Thanks, Dylan. Sorry, there's a lot of background noise, so I've been muting myself off and on. So I was going to say that the evidence-based practice project is something you don't necessarily want to get too tangled up with. It's a group project. You're not alone. It's not on your own time. We have coaches that work with you the whole time, so you're supported the whole way through it.
Thank you, Christy.
You're welcome. Tiffany, did you have a question for the panelists?
Yeah, I just wanted to say thank you for all the advice and information this morning. I wanted to ask, were there any resources that any of you used to like improve your cover letter and resume? I know that you can like ask kind of mentors and stuff, but were there any like online resources used, and how did you know if like you quote unquote had a solid cover letter or resume? And I know that Dylan kind of touched on how he prepared for interviews earlier, but I was wondering if there were like interview questions that he used, or like if there were any other resources used for that also.
Alicia, you want to take that one?
Stanford offers an interview prep webinar as well, which I personally attended. And that was super, super helpful because they actually give you example questions that they may potentially ask you in the interview. And that helped me better prepare in terms of tailoring my answers to those questions. And they're very, very helpful in terms of how to answer the question. So definitely attend that webinar if you guys can. And I think just having people review with you, a different set of eyes is always helpful. And then giving yourself a break from time to time, write out your answers, write out whatever you need to, take a break, come back to it another day. That's why definitely give yourself plenty of time to prepare, so that you have that opportunity to go back and review things. It happened to me that I would write stuff down one day. I would come back to it a couple days later and I'd be like, oh yeah, that was good, but let me add this, or I forgot to add this. So yeah, definitely giving yourself some time. Don't rush through it. And yeah, be thoughtful about your answers and make them unique to yourself as well.
Okay, thank you.
Hi, Allie, did you have a question for the panelists?
Hi again. I had a question about like letters versus the short answer question, or the answer, I guess they're not short answer, but the essay questions. My first question was if you want to differentiate between your cover letter, or is it okay to overlap with some of the answers of the essay questions? And also just the average length that you guys had for your essay questions.
Cole, did you want to try and answer Allie's question?
Yeah, so I would say for my cover letter, it was more kind of like an introduction of who I was, of who I am, a little bit of my background, my education, my work experience, and then how all of those kind of experiences, um, and like my kind of work values align with Stanford values and kind of what I hope to see myself doing in the future. Um, so that was kind of more the focus of my cover letter. Mine was probably a little bit over a page, and it probably could have been shortened a little bit. Um, and then I don't think I had too many repeating things into my essays, just because I think my essay questions were a little bit more focused and pointed. So I would say the essay questions are more situational, and then the cover letter is a little bit more about you and kind of how your, you know, values, beliefs, and everything are kind of aligned with, Stanford's. Does that make sense?
Yeah, it definitely does. I was just thinking of like what the impetus for why I went into nursing was. I thought about writing that in the cover letter, but then we have this essay question. I don't necessarily want to repeat myself. So I didn't know if like I should broadly talk about it in the cover letter and then way more pointed in the essay.
Oh, okay, I see what you're saying. So, good question. So I had a similar thing. My personal family experience definitely impacted my decision to go into nursing. And so, yes, I did kind of broadly talk about that in my cover letter. But then in my essay question, I was able to expand upon it and use like a more specific example. So, yes, I double dipped a little bit, but it was more broad and then focused.
Okay, thank you. That helps a lot.
Thanks, Allie. Melanie, did you have a question for the panelists?
I do. I was wondering if the in-person interview questions differ from the application questions. Like, will you get critical thinking questions? Like maybe something you might see on the NCLEX? Do they kind of test you in that way, I guess?
So I can take that one. So in terms of the interview, and I'll also promote kind of like I think Nicole and maybe Alicia, probably all three of them have mentioned. You're definitely going to watch the want to watch the interview webinars because they'll answer that question for you. The
Okay.
interview questions though are more behavioral in style, so not so much critical thinking, but more so how you would respond to a situation that you've had. So they want to ask you about those kind of questions so they understand how you would respond in the future should a similar situation come up. So themes are somewhat similar, not the same as the application questions, though.
Okay, thank you.
You're welcome. Maxine, did you have a question for the panelists?
Yes, can you hear me okay?
Yes.
Perfect. Again, to echo everybody, thank you so much for having this informational session. Makes me super excited to apply. And my question was, I know Stanford is, one of the primer research institutions, and so I was wondering if any or all of the units have a potential to be connected to research or clinical trials, if that's kind of like a part of it. And then my secondary question is this also like kind of like a way to transition into like an actual full-time position if we do choose to stay past the residency?
The positions hired into are full-time positions. They're not part-time. Maybe I
Oh,
missed understanding what you were
oh,
asking.
right. I understand like it is a full-time residency position for a full year, but after that year, can you like continue and be hired on to
You
be,
are hired on.
oh, literally like day one.
Yep,
Okay,
yep.
wonderful. Okay.
Day one, you work for Stanford. So you're working with within the nurse residency program is a like a supportive measure through this time, but we don't actually hire you. You are hired by the hiring managers for whatever area you hire into. So whether it's float pool or the emergency department or an oncology unit, those hiring managers hire you. You work on that unit with their trained preceptors, and then the nurse residency program is a support through that process.
Okay, thank you.
You're
And then
welcome.
yeah, to the first part of the question, I know again it's a residency, so there's probably like a format and programming. But are there certain units that are being offered for the fall cohort that are more like involved with research or clinical trials? Just because I have a background in that, and so I just wanted to continue those kinds of efforts if it is, at all possible, and helps kind of narrow down my choices and rankings for the application.
Sure. So in terms of the application, so um, during that, it's kind of hard. It's a hard question to answer because during that first um, year, and I might have this slightly wrong, but during that first period of time, you actually aren't going to be participating in that, nor the research part. But there are opportunities once you're past the probationary period, once you're out of the residency program, to start participating more in other opportunities within the organization that, we have a shared leadership council that focuses on research, for example, so you can join that committee and be part of that. And within the residency program, we actually bring individuals in that are like nurse scientists and have a more of a research background. You can have an opportunity to speak with them and kind of talk with them a little bit about their path and then how one who is interested in that might start to move towards that kind of direction, if that makes sense.
Oh, no, absolutely. That answered my question. Thank you so much.
You're welcome. You're welcome. Candace, did you have a question?
Yes, thank you. I do have a question. So for our program, I know that on the resume that you showed us, it says internship and externship. But I'm aware that like not every student has that opportunity, or I think preceptorships used to be much more common until the pandemic hit and it kind of became more of a rarity. And so in my program, instead of having a preceptorship, there's something called like a senior synthesis, which is similar to like clinical rotations and stuff like that. And so does that mean for us, if we didn't get that preceptorship opportunity, we don't put anything for the internship and externship category then?
So the internship and externship is outside of school,
Oh, okay.
unrelated. So if your senior synthesis is part of schooling, so that would not apply to the externship or internship.
Got it. And is it like preferred?
Oh, okay, no problem. Sorry about that. Yeah.
Sorry, go ahead, Candace.
Yeah, is it required or like preferred for an internship or externship? No? Okay, cool. Thank you.
You're welcome. Allison, did you have a question for the panelists?
Yes, thank you. Two-part question. So I'm curious what kind of program the panelist graduated from, whether that was the ADN, BSN, or MSN. And then I'm also curious to know what the standards look like for patient care at Stanford compared to maybe where they did their clinicals.
Alicia, will you want to answer that one?
Sure. I'm sorry, can you repeat the first part of your question?
What program did you graduate from?
I graduated from an entry-level master's program. I had my bachelor's degree prior, but in a different area of study. So I got my master's in nursing. And as far as patient care compared to other institutions that I've been to, I think Stanford is very I don't know if this is the right word, but maybe like organized in terms of how they do things. There's policies for literally everything. So if you ever have a question about something, you can always refer back to a policy. Um, Stanford is super evidence-based focused. So everything that Stanford does, it's very intentional. And there's always a reason for it. If you ever have a question about anything, everyone always encourages you to be curious and ask why so that you're understanding what you're doing versus just doing it blindly. I haven't worked at a different institution, but based on my clinical rotations, that's something that I definitely noticed. And Stanford has a very patient-centered focus. So, you're not just thinking about the situation, you're thinking about the entire individual. And that's like from a social aspect, from a clinical aspect, from a financial aspect, like the interdisciplinary team within Stanford is amazing. Case managers are super involved in patient care, physical therapy, occupational therapy, like every aspect of patient care is super involved, and the communication between the interdisciplinary team is great as well. So I think that is something that I've really, really appreciated about being here at Stanford.
That's awesome. Thank you. Could I hear from Dylan and Nicole briefly where you guys graduated from? What kind of program?
Sure. I graduated from San Francisco State for a bachelor's of science in nursing. Probably not the best to answer this question because I did 3 or 4 rotations at Stanford and LPCH, so that's kind of what I'm most familiar with. I did, but then on the other extreme of that is I went to San Francisco where I was in the Tenderloin, which is I think the complete opposite of the spectrum, where it's a very impoverished part of the city with a very limited access to resources. So that being said, Stanford, though, from hearing from my peers, definitely has more access to a lot of additional resources. I mean, even during a normal day on day shift, like each of your patients will have OT, PT, dietitian will visit, the doctors will round, consults will come by, and you're keeping track of all of that while trying to give meds. So it can be a lot, but you have your peers and your resources there. Trying to think. Was there another part of the question I missed?
No, that's it. I was just curious what kind of program you graduated from. Thank you so much.
And then sorry, I think you mentioned something about evidence-based practice. At least for my unit, we'll do every month or two. We'll or maybe every couple of months, we do like a get together for every nurse on the unit where we host like new learning. We host like lessons from either the doctors on the unit for the most current up-to-date practices that we're going to trial. And so like most recently, we usually give a specific drug and we usually give pre-medications for this drug, but we're trialing a different process of we give this drug 3 times over 3 days. Why are we pre-medding on the 3rd time if we know they're not having a reaction the first 2 times? So just trying to update our clinical practice is just something Stanford's always striving for and something that I've personally seen too.
Thank you.
Thanks, Dylan. Well, everybody, we really appreciate your time. I know there's a few more questions in the chat, but we are at time right now, and I want to be respectful of our panelists and everyone on the call. So for those of you who still have questions, if there's something that we haven't covered or something very specific related to the residency program, I'm going to encourage you to go to our careers page and go to the ask more questions and, go ahead and go there. If you don't see what you need there, you can reach out to New Grad RN at stanfordhealthcare.org to also potentially address your question. Thank you, Nicole, Dylan, and Alicia, for your time today. You guys have been great. Thank you to everybody on the call. We really appreciate you, and we look forward to seeing your applications. Remember to take your time, sort all that stuff out, and we look forward to reading them all, okay? Have a great afternoon, everyone. Take care. Bye-bye.
Thank you.